Hello and welcome to Lights, Camera, Baby, the podcast where we support you through every stage, from pregnancy to parenting, with expert insights, honest conversations, and a whole lot of reassurance, of course. Today's episode now is all about understanding your body in a completely different way. Because pregnancy isn't just something your body goes through, right? It's something your entire nervous system is navigating. And what if the way your body adapts during pregnancy could actually influence your comfort, your birth experience, and even your baby's development? But before we begin, just a quick note. This podcast is intended for information and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. So always consult your healthcare provider or a qualified medical practitioner with any concerns regarding your health or your baby's health. Today, I'm delighted to be joined by Dr. Jacqui Bunge, a pediatric and perinatal chiropractor with over 20 years of experience, clinical experience, that is, dedicated to supporting families from pregnancy through the early years of childhood. Now, she's completed her master's degree in chiropractic at the University of Johannesburg, and she has gone on to pursue extensive postgraduate training in pediatrics, neurodevelopment, and perinatal care, and including advanced studies in pediatric musculoskeletal health in the UK. Dr. Jacqui is also a certified lactation consultant, and her work focuses on how the nervous system supports pregnancy, birth, feeding, and early development. So we're delighted to have her here with us today. She's deeply passionate about collaborative care and advanced pediatric chiropractic, both in South Africa and internationally. Dr. Jacqui, thank you so much for joining us. Welcome.
Thank you so much for having me.
With all that wealth of experience, I think all our listeners are delighted to get to know you and find out about people like you that can make such a difference to their lives, right?
Well, we hope to get as many mums help and empowerment as possible during this very transitional stage of their lives.
And we're delighted that you're here to share. So, mums, hold on to your seats. There's a lot to learn today. So let's start by shifting a common perception, right? Many people think that chiropractic care is just about back pain. Now, you often speak about it in a very different way from my conversations with you, but particularly in relation to the nervous system. So can you explain this connection for us, right?
So your brain literally controls your whole body.
Right.
So it's going to control your hormones. It's going to control your musculoskeletal system. If I tell you, point your toe, the message goes into your ear, into your brain, all the way down your system. If there's a miscommunication in that system, that's when things fall apart. It's not like you're going to lose use of your toe. It's kind of like taking a hose pipe and kind of folding it in half. The message is still going through. It's just not as powerful as it should be. So we want to make sure that we're communicating throughout our body well.
Wow. That is so interesting. I never thought about it like that. So how does the nervous system now influence pregnancy and birth?
If you're looking at the nervous system, what does it control? It controls hormones. Hormones are your relaxin, your oxytocin, which is your happy hormones that you have after birth, your progesterone, your estrogen. It's literally controls your body.
Right.
It also controls your musculoskeletal system. So how your we always talk about it. Let's talk about it this way. We always talk about power, which is the power to the uterus, the power to the contractions, the power to the pelvis. So the message needs to go from the brain to the pelvis,
Right.
To get those, and also to the hormonal control as well. And then your structure, which is your passage, your pelvis has to be in position, for want of a better word. So you need to make sure that everything in that pelvis is moving well, and there's no tightness or discomfort. So those muscles need to also be in the best position and to be receiving the best influence from the brain.
Okay.
And the last thing is that baby needs to be in the right position as well. So if there's any tightness, or if there's ligaments that are too tight or anything that's going on there, that baby's going to be sitting in an awkward position, which then influences how it develops, and it also influences how it moves. And it could then influence the birth as well.
And this is all about then that brain connection to the rest of the body. And in this case, particularly, we're talking about obviously during pregnancy and that birthing experience. So what role does this communication between the brain and the body play? Why is that so necessary? Doesn't the body have this automatic reaction? I mean, we assume we're pregnant, your body gets ready. I mean, to the simple person, right? We forget that there's a deeper level, I suppose, right?
Your body is super smart, super intelligent. It has an innate ability to look after itself.
Right.
So that innate intelligence is how it kind of like knows what to do.
Mm-hmm.
But we also live in a modern world.
Yes.
Where you might have a toddler, so now you're growing a belly and you're not putting your child on your hip. So all of a sudden, that communication from the brain to, let's say, your pelvis might not be as sharp as it should be. We also live in a world where we in fight and flight. Cortisol is a huge topic at the moment.
Huge.
And if your nervous system is in fight and flight, how do you bake a baby well?
Mm-hmm.
You want to focus into more parasympathetic, rest and digest, get that baby baking well, for want of a better word. So we want to calm those nervous systems down in a world where everything's in disarray. You want to be empowered and you want to be calm and you want to be growing your baby well.
Okay.
So it's literally about the brain being the communicator to the rest of the body.
I get you.
And keeping that open.
Now, you've described pregnancies not as a condition, but as a transformation of the body, right? I mean, not just the body, but as a whole. From your perspective, what's really happening in the body during pregnancy, particularly now?
So obviously you have that the hormones are huge.
Yes.
Any woman knows hormones are
drive our lives.
Pretty much. First trimester is pretty tricky with hormones, and then last trimester as well. The main culprit is relaxin. So it does exactly what it says, relaxes those ligaments to help your body. Your body doesn't know that you're going to have a C-section, or your body doesn't know that you're going to have natural birth. So it releases this relaxin, which goes into the body, which releases the ligaments. But the problem with that is then the muscles have to work harder to try and compensate.
Oh, I see.
So when those muscles work really hard, that's when you can feel that discomfort. So it is not normal to be in pain. It's common to be in pain. A lot of people are like, well, I had back pain during my pregnancy. That's normal. No. Pain is not normal. Pain is your body's way of saying, actually, something's wrong. Please help me. Your body's always going to try and help fix itself. But if it can't, it's going to ask you for help and in that way show pain. Okay.
So what happens biomechanically as the body adapts now?
So think about that big tummy growing at the front.
Yeah.
So your center of gravity changes, right?
Yes.
You can't reach your feet anymore to put your shoes on because your muscles are tightening to stiffen you up. You're also shortening into your back, so you kind of increase that lumbar lordosis, so those muscles can tighten.
Right.
It kind of switches off your bum muscles, so those stop working. Also, if you have a toddler and you're carrying a toddler and you have a bump at the front.
Oof. Yes.
Because
we all
your first
remember those
pregnancy,
days.
Everybody can go home and have a nap. The second pregnancy, there's no nap time.
No.
So it's literally that body's changing and you're changing emotionally, because now we live in a world where we are in control of everything. And all of a sudden you're going to be giving birth. You don't have control of the date unless you're having a C-section. You don't have control over what happens. No. That emotional experience can drive you into that parasympathetic fight and flight. So we want to keep all our moms as calm and in tune with their bodies as we live in a world where our watches tell us when to breathe, when to walk, when to talk. And as soon as you have a pregnancy, then people don't know what to do anymore. They forget that their bodies know how to do this.
And that's so interesting because, like you're saying, our brains play such an influence on the rest of our bodies, right? And during this time, with the hormones wreaking havoc, probably the addition of a toddler in your life and this changing body, your mind starts playing tricks on you. So now what you're saying to me is that what my mind is telling me is affecting how my body
Pretty much
reacts and where the strains and pains are, because my mind is dictating.
You can only juggle so many balls. Throw something extra into the mix like stress, cortisol, anything that flu, whatever it is, and you're going to drop a ball. So your body's going to say, actually, I can't do all of it. You need to help me with X, Y, or Z. And it's usually comes out as neck pain, lower back pain. These poor mums get lightning crotch. It's hard.
Gosh, that places a lot of strain on the body, right? I mean, that is intense. And that's why as when we're pregnant, I mean, if I go back to both my pregnancies, and I think about all those aches and pains, I can absolutely identify. And at that time, I didn't know where it was coming from. It didn't make sense because, we don't know this information. This kind of information wasn't available when I was pregnant. And I'm so glad that we can highlight this for all our mums, because your body's constantly adapting, right? Structurally, neurologically, wow, all at the same time. And
emotionally.
And emotionally. Yeah, that is so true.
Because hormones wreck your emotions.
Okay, so let's break that down a little bit further, right? Let's look at those major changes. Let's highlight that for our moms. What are the major changes that are happening during the pregnancy?
Okay, so hormones is your big major change.
Right.
Okay. So you're going to have relaxin, which is relaxing those ligaments, which is making your muscles work harder, which is making everything trickier for you. Structurally, you're looking at a growing belly, so your center of gravity, as we said, changes, your muscles shorten, your posture changes. Add relaxin into a posture change, and you are going to have more aches and pains than you should, because your tummy's out here. You've got to try and fit in behind the car seat or fit in at your desk and get your arm around. And posturally, everything is happening. And we don't live where we change our seats and change our ergonomics according to our body size or body structure. We still have to work. We still have to do everything that you normally do in a day. And now you're making a baby as well.
Now, how do we help moms manage this? Because this obviously creates a lot of discomfort and imbalance. So how can we help moms to manage these changes better?
I think if you know that it's not normal to be in pain.
Yeah.
I had a patient say to me the other day, she's like, Jax, I didn't know that I didn't need to have constant pain all the time. I had a 3-year-old say to me, Jax, I can't feel my head anymore. I'm assuming she's always had a headache, that she's always felt something there. So pain is not normal. We're not supposed to live in pain. Our bodies are also designed to be upright, bipedal, moving around, and we're quite sedentary.
Yes.
So what I want mums to do is get up and move as much as they can. Go for a swim, go for a walk. Just start slowly. Slowly start adding in 5 to 10 minutes a day. Stretching, moving. You're going to want to move less, but the more you move, the more you actually keep those joints lubricated. So if you are going to be doing natural birth, you can get all your joints moving beautifully and you can keep your body in shape for birth.
And it's so interesting because generally, or traditionally, we all grow up and we all have parents and we all have caregivers who want to tell us to rest, to just have a lie down and you'll feel better. But you're saying it's actually movement that is going to help you. Motion is
lotion. We got to get you moving. And you've got to be comfortable moving.
Yes.
I mean, there is a level of fatigue. Listen to your body. If you are tired, have a nap. But if you can move, if you can go for a walk, just start slowly. There's so many things out there for pregnancy and for mums, and it's really nice because it starts your baby community. It starts your little network before you have your baby.
Yes.
So you can start your mums groups already while you're pregnant.
Yeah. Absolutely.
So if you start joining these yogas and all of the things that mums do, and start meeting new people, because maybe you'll find your new bestie.
That's true.
Your mum bestie.
That's true. We all need a mum bestie during this time. Now let's look at the role of the pelvic balance. I mean, and you've used a really interesting phrase here, creating a luxury pelvis, right? What does that mean?
So I want to make sure that your pelvis is moving as well as it can.
Mm-hmm.
So your baby is obviously trying to fit in there with all your organs. So if you look at the structure of the pelvis, it's got to move, and that sacrum kind of cups in the bottom there. I should have actually brought my pelvis. And as those joints move, if they get stuck or tight, because we're sitting all the time, we're actually tightening everything up. So what we want to do is get those movement. We want that sacrum to be moving. If it gets stuck, you can change the inlet for the baby to drop down or the outlet for the baby to come out. So we want that moving. We also need your glutes and your piriformis, which are these big bum muscles on the side. If those are tight, they're going to cause that torsion. The problem with any sort of torsion is that baby's going to fit into the shape that it's in.
When you say torsion, what does that mean for
like a twist?
Okay.
A twist in that pelvis. So if one side is tight and the other side's not, you're going to kind of get a twist in that pelvis, which means, I'm going to explain it like a hot air balloon. So the round ligaments come up from the pubic bone, and as your uterus is growing, they kind of grow with your uterus. So if they're growing and your uterus is growing nice and straight and that pelvis is nice and straight, it's a straight slide out, right? If there's any twist, everybody knows they don't want their kids going down the round slide because they're going to get stuck and you're going to have to climb up to get them. So as those uterus round ligaments move up, we literally want them there, and we moving up straight like a hot air balloon, and we don't want them twisted or torqued in any different direction because then that baby is stuck in that position. We want those ligaments, we want those muscles to be as supple as possible so that baby can move. If there's any tightness or tension, that's when we get babies that are stuck in positions, babies that go breech or OP or can get flattening on their skulls when they're born. Okay. So we had a little one whose hand was literally sitting on her face, and she had a little dent from when her hand was because she's lying on mum's pelvis with her hand there because she couldn't move. So we want them to be able to move. We want them to be in a first class seat, not an economy class.
Right.
So you're not, they need to move to learn and to grow their brains.
So how do we get moms to create a luxury pelvis besides visiting a chiropractor? I mean, what can they do at home to get this going? So
moving, swimming.
Again, yeah.
There are spinning babies techniques where you can do those inversions. I don't know if you did those forward inversion techniques.
Right.
Very little sitting. We sit all the time, and it's not the best position for our bodies to be in.
Okay.
So if we look at how we sit, we're closing up that pelvis. They want to be up and open and moving around.
Right. So sitting on one of those balls, is that a
sitting on the balls, also carrying things. If you do have a toddler, you might have to carry him on your back, on your shoulders, as opposed to on one hip.
Okay.
So we're going to try and move away from doing things. Unfortunately, that's how our lives are. We're always answering our phones on the same side. We're picking things up on the same side.
Yes.
We kind of want to try and do everything as equally as possible.
So create the balance.
Create balance. Make sure you're standing on both your feet. You're not always leaning into one side. If it's sore, fix it. There's pelvic floor physios as well.
Yes, a lot of people don't realize the pelvic floor physios are available.
Overseas, it's part of your birthing experience.
But in South Africa, there is a huge community of pelvic floor physios,
and it's
right?
grown beautifully over the last couple of years. It's really, really an amazing bunch of ladies who work in pelvic floor.
Yeah, and they specifically focus on that, and it's a comfortable experience for all mums, and I think it's so beneficial.
Well, there's help.
There is help.
If you ask.
Yeah.
Or if you know.
Yes.
A lot of my mums have never heard of pelvic floor physio.
Yeah, we know of the generic physio. We have a little bit of a backache, or we sprained an ankle, or something's
100%.
pulled a muscle, and we go to the physio. But that's where it stops.
I mean, you've got that's where the baby's sitting, on that pelvis. Your ribs have flared out, so your breathing is a little bit harder and your diaphragm is a little bit tight, and the diaphragm and the pelvic floor are best friends. They can't work without each other. So if this is tight and expanded, this is going to be tight, which means you are going to have possible discomfort down there. And we don't need that tight. We need it supple. We need it loose so that you can have the beautiful birth that you plan.
Yeah, absolutely. And like you're saying, there's some simple things that we could do in our daily activities from the time we wake up till the time of going to bed. I mean, a lot of moms are still sitting at the office as well. And it's about, I suppose, creating those breaks and standing up in between as well. Yeah, it's. I think we just take a lot for granted in the beginning, especially on a first pregnancy. And we think you can carry on like normal until all these aches and pains start to surface.
And also, you're going on leave.
Yes,
for 3 months.
And then I will rest.
So then you kind of think, I need to get everything done before then. I need to plan everything. So you're actually doing more than you usually do.
Yes.
In that time frame.
Yeah.
So you're sitting for longer and you're stressing more.
Yes.
You've got to just take deep breaths and go with what your body says.
Yeah. And there's, like you're saying, I like the fact that there are available services, whether it's a chiropractor, a pelvic floor physio specialist, and then all the exercise classes, like the yoga for pregnancy and Pilates for pregnancy and gentle exercise.
Biokineticists as well. That's in your area if you don't have a class.
Yeah, a biokineticist is great. And then just small walks in between.
A swim,
a walk. Being outside and sitting on the exercise ball, I suppose, when you're watching TV might be a good.
Lie on your back, put your feet up for a little bit. You don't have to sit at it. You can move in all different positions.
Yeah, that is true. So it's get that movement going for both you and for baby. So how will the pelvic floor, just go back to that point about how does it influence your labor? Does that strengthening and creating that luxury pelvic floor or pelvis help you with a smoother delivery?
Yeah, so we don't want anything tight or taut. So we want everything to be sitting in the position that it needs to. We also want the communication from the brain to the pelvis. And we want those ligaments not to be tight. So when we're looking and assessing moms, we try and make sure. I get a lot of referrals from midwives and doulas. If their bodies look like they're out of alignment, they basically send them through just so that it makes their job easier at the end of the day. Mm-hmm. Because if your body is working and functioning optimally, it's going to give you the best possible chance to have the birth that you're looking for.
And take us through that moment when the baby's moving through the pelvis during birth, right? What happens as baby moves and what's going on in the body?
Although I said earlier it's a straight slide out, it's not. That baby has to sort of flex and move into that position. So they come down usually on that left-hand side. They then have to rotate so that head sits into that sacrum. So remember we spoke about the triangle bone at the bottom earlier and that it has to be in the right position so that baby can fit nicely to get into that inlet, which is the top part of the pelvis, and descend down. And they kind of it's called cardinal movements as they twist and they turn to get down. So birth is a communication process between mom and baby. Mom's not pushing a baby out and the baby's just
lying there
getting squeezed out. The baby has to move and twist and turn to go into the pelvis and to be born.
Wow.
So they have primitive reflexes that help them move and to help them birth as well. So I don't always when they talk about dystocia or they talk about difficulties in labor, they talk about power, which is from the nervous system. They talk about position, which is the pelvis position, and they talk about a passenger. Baby's not a passenger. Baby's a pilot. You guys are working together, navigating that birth process.
That is so fascinating to realize that there's this whole coordination happening between mom and baby at that time. And
there's that instinctual, and that's what I said earlier, we we forget that we actually can do this. Moms are powerful. They're amazing. They just baked a baby. Like when that baby comes out and you see those perfect little fingers, and
It's amazing.
it's unreal.
It really is.
Like I always say to my moms, you made that.
Yeah, you do. It's fascinating. It really does. And you don't realize how much of effort it takes and what your body goes through to bake that, right?
100%. So we've got to give your body the best possible care so that you can be the powerful person that you're meant to be.
Then we move on to the postpartum phase, right? I think this obviously isn't spoken about enough, I feel. No. What happens when after baby arrives? And you see mothers going through this postpartum phase, I'm sure. What are you actually seeing here?
You see, for me, I'm probably the first person who says to the mom, how are you? Because everybody comes in and sees a baby and wants to talk to the baby.
How's baby?
Like, how's mom?
How's mom doing?
You just made a baby.
Yeah.
And it's huge hormonal shifts again. So, and that relaxant doesn't go away. So now you've still got this hypermobile body, this body that moves too much, and these muscles that are working really hard to stabilize it. You've got your oxytocin, which comes out. But a lot of our births are quite medical. So they wrap your baby up and give them to you. Try and unwrap your baby, put your baby on you, get that skin to skin, get that oxytocin, which is your happy hormones, moving through your body as quickly as possible so that we can stabilize those drops in your hormones and in your, that hormonal drop that you can experience. Because postpartum blues is pretty normal. It's pretty common because those hormones are all over the place. We've got to try and just level them up as much as we can by keeping baby on you and close to you and facilitating that as much as possible.
Because again, I'm assuming that connection sends messaging from the brain to the rest of the body for healing, etc.
Yeah. Skin to skin is probably the most powerful thing you can give to a mom to do.
So it's not just good for the baby, but it's good for the mom. That's what you're saying.
It kind of levels you both out. It helps with that uterine contraction again. It helps with your milk supply. It stabilizes baby's temperature. It stabilizes both your hormones, and your baby is back where it needs to be, on your chest, nice and warm, hearing your heartbeat. So the change from being inside to being earthside isn't so dramatic.
Yes.
Remember when I was inside your tummy, it was dark, it was quiet, voices were muffled. And now we're possibly in a hospital where it's bright and it's light and there's people and it's noisy. And it's all these new things I've got to learn. But if I'm on my mum and I can hear her heart and I know where I am, I'm okay.
Completely. I mean, and so look at all those other changes that are happening in terms of to their bodies. Let's look at structurally, right?
So you're now starting to feed, whether you're breastfeeding or bottle feeding. You're still sitting in that position where you're hunched over, your head is forward. If you're breastfeeding and it's hurting, which it shouldn't hurt, a lot of moms start clenching their jaw. You've never breastfed before, and a lot of the time you've never seen someone breastfeed because we're kind of not in a society where it's okay to breastfeed in public. So the first time you're feeding your baby is the first time you've ever seen it. So now you've got to try and figure out how to put your baby on you, what position works for you. Baby's also got to figure it out because they're so used to having food on tap, and now they got to learn how to feed.
Yeah.
That milk hasn't come in yet, and a lot of the time the mums are so stressed about getting it right that they're sitting there with their heads forward, their shoulders up, their jaws clenched, and everything's like tight and sore. A lot of the times mums will walk in with their babies and I'll be like, who am I treating? And they're like, no, the baby. I'm like, you are limping. You are first, and then we'll treat. Because if you're not okay, how do you look after your baby? And you're the primary caregiver because usually dads are going back to work quite quickly.
And how is this affecting how does the negative posture and the negative movement that is happening after birth, if we don't get to experience the baby on my chest and the oxytocin, and I'm sitting in an awkward position and I don't know how to feed, how is it affecting your recovery?
So we need to make sure that mums are at the best possible position. One of the things that I say to mums is, what we want you to do is your baby can move. When they're breastfeeding, a lot of the time they're moving towards their baby.
Yes.
So they're kind of moving their boob forward. Lie back, make yourself comfortable, and then look after the baby. Babies cry. If your baby's crying and you desperately need a cup of tea and you need 5 minutes on your own, take 5 minutes. If your baby's crying, they're breathing. They're okay.
Yeah, that is true.
You need to look after yourself first and foremost.
Yeah.
And then your care to your baby will be easier.
And are these some of the challenges, the common challenges that you're seeing?
One of the biggest things I think is society-wise is we live in a society where we're behind walls and closed gates and we're no longer in the community. There's some cultures and religions where they move in with mum.
Yes.
Which is phenomenal. And it would be great if all cultures do that, but they don't. So there you are on your own trying to navigate this journey called motherhood that your baby doesn't come with an instruction manual.
No.
So you don't know how they're supposed to be doing what they're supposed to be doing or what you're supposed to be doing. You don't write an exam to get a baby.
No, sadly not.
You just get given your baby and tell them to go home. So we've got to make sure that mums look after themselves first. And they ask for help. And if you know somebody who's having a baby, offer help, offer food, take a meal. My favorite gift for a baby shower is Frozen for You voucher.
Perfect. It's what you need most.
It's what you need most. Somebody looking after you, food. You need to eat.
Yeah. That is so true. So, we're talking about supporting mum, and which means if you're supporting mum, you're supporting baby.
100%.
We're supporting mum's nervous system, which ultimately leads to her comfort, baby's comfort.
And regulation. You're regulating both of you.
Yeah. Because they become so dependent on each other,
100%.
right?
If mum is stressed, baby's stressed.
Right. And sometimes you wonder, why is baby crying? But when you stop and take a look back at yourself in the mirror and understand what's happening here, then you can understand that.
First-time mums, I love seeing my second-time mums. If I see them for their first baby and then they come back for their second baby, they're just a different person because they realize that they can actually do this.
Yeah.
I think it's the confidence, the lack of confidence people have in themselves, women especially have in themselves. And it's something that we just expect so much of. You expect so much. And I think it is an Instagram problem as well. You see these perfect babies lying on their tummies, sleeping, and you get your baby and your baby decides it's not sleeping today. It just wants to be on you all the time, which is also okay. You can hold your baby if you need to hold your baby. You can carry your baby in a wrap and still have your cup of tea. Because then your baby's on you. He's calm and comfortable. They're calm and comfortable. And you calm because your baby's calm. So you guys are going to be regulating and feeding off each other the whole time.
And that's why you speak about mom and baby as a unit.
Yes.
Right? Explain that connection a little bit deeper now, because does that go back to that connection because of that nervous system connection during pregnancy and that being so connected?
Well, your baby, you made that baby.
Yeah.
That is now your soul or your heart on the outside of your body for the rest of your life, right?
Yes, that's the best way to explain it. It's your heart walking outside your body.
And there's nothing you can do. You can't be there all the time. So often when I lecture, I talk about vagus nerve. So vagus nerve is your parasympathetic, your fight and flight. And I always say in my lectures that vagal tone is contagious. So if you walk into a room where everybody's upset and everybody's angry, chances are you're going to get upset and angry. You pick up what they're putting out.
That's true.
So if you walk into a room where everybody's happy and everybody's laughing and everybody's joyous, it changes your whole mood, right?
Yes.
So this is where that connection comes in. And with mums and babies, I think it's even stronger. Like we've got an instinct that we forget that we have.
Yes.
Like that deep feeling inside your body. And again, because we live in modern society, we forget about it.
And how does stress or calm transfer between mom and baby? I mean, like, this is now, during pregnancy, I can understand that. But why is that connection still so? It's
amazing, right?
Yeah.
Our bodies are amazing.
It really is, because, I mean, I remember sitting with my baby and I had gone through a bad day at the office. I think I'd just gone back after maternity leave and I came back home and I had baby in my arms and she was 3 or 4 months old at the time. And I was very emotional and she started crying. And I was so surprised that she could understand what I was feeling. I was, yeah.
Babies are so innocent and so amazing. Like they can read you and they speak a language that we don't always understand.
Yeah.
And the more you're around them, the more you actually realize you can read their signals and they read yours.
Yeah.
That connection is just amazing. You can't explain it.
Yeah. So you're saying to us now as well that when we support mum, we're actually supporting baby too.
That's it.
Right? So that community that sets up around mum is
you set up that family unit. Because if we're not getting that decreased fight and flight, that parasympathetic, that rest and digest, that's where baby learns, that's where everything's happening. That's where mom smiles at the baby learns how to smile back. If you've got a mom with postpartum who's not smiling or making contact with that baby, what experience is that baby going to have?
Yeah, I get you. So for moms that are listening, right, who might be feeling overwhelmed and disconnected from her body, what would you want her to know today?
If you need a duvet day, have a duvet day. Babies are going to have days where they are having a bad day because they have bad days. They're not robots, they're babies.
Yeah.
Get into bed, put your baby skin to skin, and have a duvet day. You don't have to do the dishes. You don't have to make dinner. You can just take care of yourself.
Absolutely.
Be with your baby. This moment, this time is so short. Enjoy it as much as you can. And that's kind of what I try and do with all my moms, is try and get them to have the best possible journey that they can have. Because you go back to work.
Yep.
And that's hard.
That's the most difficult. It is. So if there's one thing you take from this today, I think for our moms, it's this: your body is not failing you. It's adapting, it's adjusting, and doing an incredible amount of work behind the scenes. And when we support the process, we support both mom and baby. Dr. Jacqui, thank you so much for all your insights with us again. And if moms would like to connect with you, how can they do that?
Social media, we are Chiro Kids SA, I think, or just go onto our Chiro Kids website and you can find us there.
All right, wonderful.
Thank you.
That's really great. So to moms listening and dads, take a moment to check in with yourself today, because moms and dads, you matter too. You are a unit with that baby. And if this episode resonated with you, please feel free to share it with another mom who might need it too. And don't forget to keep following us on Lights, Camera, Baby for more expert-led conversations. Until next time, we'll see you soon.